My name is Jack Boniface. My student number is 2009841 and this is my STYCO1 practical video. And today I will be doing my demonstration on a hamstring of a client, but it will be conducted on a pillow because I am a part-time worker and I am trying to avoid as much contact with my family as possible. So in this video we will go over the contraindications between the client and the therapist and also the treatment itself. Within the treatment we will go over effleurage, petrissage, tapotement, frictions and trigger points, and finally finish off with me doing a demonstration of a muscle energy technique using post-isometric relaxation. The outcome goals of this are that the client should feel a reduced pain in the area as well as get an increased range of movement in the hamstring. Contraindications. These are very important for the client and the therapist. This is because it helps to protect both of them from any damage being caused. This may include skin conditions. If one of the therapist or the client have it, they could be spread to the other and cause damage. If DVT or any heart problems are being found, such as or cancers, these should not be treated on and they should be referred to a medical specialist straight away. When conducting the contraindications, observations and palpations will be done, and with these, if any problems such as swelling, bruising, any lumps or bumps that they don't know about are found, then treatment should not be conducted, or they should not be conducted in that area and they should be avoided at all times. When conducting the contraindications, there are also a questionnaire that they would go over between the client and the therapist. These can include FREDS, and FREDS stands for thyroid problems, heart problems, rheumatoid arthritis, epilepsy, asthma, diabetes and steroid problems. There are also many other ones, contraindications that the therapist should watch out for. A temperature, should watch out for a temperature, also open wounds. They should know if they had any cancers or previous cancers. They should look out for the client's medical history and their family history, and with this they should get informed consent to know if they could treat on the client. This will allow the therapist to do the treatment if no problems are found. When conducting the treatment, the therapist should have washed their hands and they should be well hygiene. They shouldn't come in drunk or after any alcohol consumption. They should be well dressed for the appropriate treatment that they are about to conduct, and all jewellery, watches and nails should be off and the nails should be at the right length. When conducting the treatment, the posture should be a straight back, as this helps to reduce fatigue throughout the treatment, as the therapist would be doing more than one treatment in a day. If they were hunched over for most of the treatment, it would affect the treatment that is going on, as the techniques would be poor and they would get tired out quite fast. So that should not be allowed. But for the purpose of this video, my posture will be quite poor because I have to bend down quite a bit to reach the pillow on the bed. For this is the hamstring, so this is the proximal end and this is the distal end of the hamstring, so this would be towards the knee and this would be towards the hip. This is the lateral side and this is the medial side. The lateral side would be the bicep femoris, the centre would be the semitendinosus and the medial side would be the semimembranosus. And here we'll start with effleurage. Effleurage is a light stroking technique that is mostly directed towards the heart. This is so it can encourage venous return. Venous return helps to increase the blood flow to the area. With this increased blood flow, more nutrients are being brought back to the area, which will help the recovery process. So light strokes, but more pressure should be on the way up and light pressure on the way back. So more pressure up, less pressure back. Effleurage is also good because it helps to get the therapist and the clients in touch with each other and get the client used to the therapist's touch. When conducting F-large, it should cover a range of the whole muscle itself. It shouldn't just cover one part. F-large tends to cover quite a bit of the muscle. And then next we move on to petrissage. For this, I'm going to move the pillow this way. So just pretend I'm on the side of the client, facing this way, and the client's leg is this way. So this is the distal end now, and this is the proximal end. The proximal end, and this will be the medial side, and this will be the lateral side. So for this purpose, I'm going to be working on the semimembranosus now. And with the semimembranosus, I'm going to demonstrate a bit of petrissage, and I'm going to be doing picking up and rolling. Here, you pick up the skin and the muscle, so it lifts it away and it increases the elasticity, and you can get in, you can roll the muscle quite a bit and get in quite deep. That is one of the things petrissage does. It is quite a deeper more massage, so it allows to get further into the muscle and help to break down some of those fibres and increase that elasticity. Petrissage is also quite useful, and it isn't always directed towards the heart. It can be sometimes directed away from the heart. This helps to create a pressure gap in the area that you are treating, and with this you can create a vacuum, and with this it takes the blood away, so more fresh blood can come in. So if I did that quite deep into the muscle, there is now blood that has been taken away, so more fresh blood can come in. Petrissage is also useful as it helps to relax the muscle. Getting deep in, helping break those fibres is helping to relax the muscle. Next we move on to deployment. Deployment is not really used too much within massage techniques, you would see. It is more used between pre-events and just after events, as it helps to stimulate the muscle. It doesn't have so much of an effect on the actual recovery, but it is a good way of getting the muscles back to it's a good way of getting the muscles to get ready for the event that they are taking. So if like the client you were treating was to do some exercise after, deployment would be a good way. There are different techniques to use in deployment. You have hacking, which is like this. You have cupping, which helps to create a vacuum underneath, so the skin is raised as you do it and allows the blood to get into the muscles. And you also have pounding. Pounding is where you get your fists into a ball shape and you pound the muscle. Working from distally to proximal. To finish, or not to finish, sorry, we have trigger points. With the trigger points, they can be quite painful, so you have to inform the client what you're going to do. It's going to be painful for them, so when you do it, you have to make sure what you're doing and working on is correct, as it could leave the client with a bit of pain. So when you're going around and doing your palpations, you might find a few bundles of like muscle. You might feel like little jelly tots, and these are muscles that haven't aligned properly, and they haven't aligned properly, so it isn't allowing for greater function. So what trigger points and frictions are able to do is you're able to put pressure down on the bundle, and it allows it to break down the fibres so they can realign, and it helps to stimulate the healing process. This should be conducted for about 10 to 15 seconds at a pain scale of about 7 out of 10 for the client. If the client says it is too painful, you should ease pressure off or just not do it. But it is very useful because it does help to break down those fibres so they can realign in a better way, which gives more strength to the hamstring. When you're doing this, the client should start to feel a numbness, and the pain should go away with quite fast. To finish, we're going to be doing a muscle energy technique. Muscle energy techniques are very useful as they help to give the client an increased range of movement. I will demonstrate one now doing post-isometric relaxation. So for this one, you would get the client to lay down on their back as such, and you would get them to lift their leg up so the hamstring is coming up, and you would get them to hold it at their range of motion. And once there, the therapist will go behind them and they will hold the leg in position. Once the leg is held in position, the client takes a deep breath in, and the therapist will start counting down from 10. With this, the client pushes down with about 40% of their power down against the therapist, and the therapist holds it in position. Once it is held in position, it will cause the muscle to contract and push, but no movement will occur. After the 10 seconds, it's been counted down between the communication. The client will take the deep breath out and relax all the muscles in the leg that they were contracting. And then the therapist has a short space of time to be able to move the legs slightly up, increasing the range of movement further. This should be done about 3 to 5 times on each leg, and it will allow the range of motion to be improved on a much greater scale. This has been my STYCO1 practical video. Thank you very much for listening.